everyone, I'm Dr. Jo Ann. I'm a dentist here at Dental Designs, and today we're going to talk about the common questions that a dentist normally hears. So one of the most common questions I get is, I want veneers because I don't like my smile. And I hear this all the time, and I think the most important thing is to figure out what you don't like about your smile. Is it the shape of your teeth, the size, the positioning, is it crooked? All of this is really important to know because it will affect what kind of treatment we can do to get you there. So instead of jumping straight into veneers, sometimes there are more conservative options like maybe just whitening, could be Invisalign, or it could just be a simple reshaping of the tooth. So veneers are irreversible, so it's really important to know what you want to achieve before we know what treatment to choose to get you there. So I guess the moral is don't choose the treatment before you actually know what you want. Alright, so the next common question I always get is, I chipped the tooth but it doesn't hurt, so it should be fine, right? So my answer to this question is that pain is not the first reason why you should be coming to the dentist. The chip is actually the first sign, and teeth don't always hurt when there's actually something wrong. So a small chip in the tooth, it could be minor, but it could also be a big crack in the tooth. It could be exposed dentine, or it could even be damage to the nerve. And so these are big reasons why you would want to come in earlier to get that chip looked at. And sometimes a chip can actually get worse the more that you bite onto it. So I think it's important at the first sign of a tooth chipping, you should come in and get it checked so we know whether it's going to be a small problem or a big problem. Another question I always get is this going to hurt? My goal here as the dentist is not to hurt you, it's actually to help you, and I will do everything that I can to keep you comfortable. So we have local anesthetics, we have numbing gel, and most importantly, just know that you are in control. So if anything is really painful, you can stop me at any time and raise your hand. For most routine dental treatments, it shouldn't be painful. You might feel some vibrations, you might feel some pressure, but you shouldn't be feeling any really sharp pain. If you are, you can always let us know and we can stop and take breaks or give you more anesthetic if needed. And so I think importantly is to know that you are in control. You don't have to just sit through it and suffer through it. Please let us know when you're feeling uncomfortable and we'll work with you through it. So another common question I get is, my tooth hurts when I eat something sweet. What should I do? And it's a very common symptom. Whenever your tooth hurts when you eat something sweet, it usually means that there's a cavity in your tooth. Other symptoms to look out for would be food getting stuck in the same spot all the time, or sensitivity to hot and cold, or pain when you're chewing. So these are other signs to look out for as well. So it's really important to look out for these types of symptoms and let your dentist know, because we'll be putting together all this information to figure out what's actually wrong with your tooth. So a sensitivity to sweet could be a cavity, but it could also be exposed dentine, tooth wear, it could be cracks, it could be a number of things. So it's always important when your tooth starts to get a little sensitive, come in and see your dentist and get it checked. Okay, so that's it for the video today. I hope it has been helpful, and feel free to check out our website to get more information on all the symptoms that you might be having, or feel free to come in for a consult and we can check that for you. Bye!